and welcome back to the lecture number 5 of General Anatomy, in which we will talk about the directional terms used to describe the human body. In this lecture, we will discuss about the directional views and the directional terms. And remember, use anatomical position for the description of terms and views. First of all, we will talk about the views of the body. That includes an anterior view, a posterior view, and a lateral view. These views are very important, as for the study of the ribs we should use an anterior view, and for the study of spine we should use a posterior view, and for the structure of the arm the lateral view is useful. Now the directional terms. The first one is the anterior one, which means the front, or the posterior, that is the back. Sometimes the terms ventral and dorsal are used. The ventral means towards the front and dorsal means towards the back. For example, the ribs are anterior to the lungs and the heart, or the heart and lungs are posterior to the ribs. Now the terms superior and inferior. The superior means upward or towards the head, and inferior means towards the foot. The term cranial and caudal are also used. The cranial terms mean towards the cranium of the body, that is the skull, or the caudal, that means the tail. For example, the chest is superior to the abdominal structure and abdominal structure are inferior to the chest structures. The term medial and lateral. The medial means towards the midline of the body, and lateral means away from the midline of the body. For example, the heart is medial to the lungs, or the lungs are lateral to the heart. The term proximal and distal. The proximal means towards the origin or the trunk of the body, and distal means away from the trunk or the region of the body. As in upper limb, humerus is proximal to the hand bones, and in lower limb, the femur is proximal to the foot bones. Now the term superficial and deep. The superficial means towards the surface and deep means away from the surface. If we divide a human body in different layers from the skin to the bones, then the muscles are superficial to the bones and bones are deep to the muscles. The term external and internal are also used. The external means towards the surface and internal means away from the surface. The term unilateral, that means one side of the body. Then the bilateral, that means both sides of the body. And the ipsilateral, that means same side of the body. For example, the arm and the leg of the same side. Or the contralateral, that means opposite side. For example, the arm of one side is contralateral to the leg of the opposite side. If you like my video, then like, share and subscribe. And don't forget to press the bell icon. Thank you.